Hi, are there any treatment for liver failure? By cirrhosismedication.com. So, what is liver failure? Liver failure is a condition where the liver can't function any longer as part of normal body processes. When this happens, the large part of the organ are already severely damaged, also called hepatic insufficiency. It can be classified as chronic or acute. Both scenarios require immediate medical care as liver failure is a life-threatening condition. So, are there any treatment for chronic conditions? In chronic cases, liver failure slowly occurs through many years. This may be caused by cirrhosis, hepatitis B, hepatitis C, malnutrition, or long-term consumption of alcohol. This may also be caused by the hereditary disorder wherein the body excessively absorbs iron, also called hemochromatosis. Treatment for liver failure in chronic cases is initially aimed towards saving the remaining functioning parts of the organ. At worst, liver transplant is needed. Cirrhosis. Treatments associated with cirrhosis are often for managing symptoms and avoid further liver damage. In advanced stages, the only option is a transplant. In hepatitis B cases, chronic hepatitis B infection for more than 6 months is treated with the aim to minimize damage to the liver using nucleoside reverse transcriptase inhibitors (NRTIs) or interferons, among others. However, the virus can only be slowed down or prevented from multiplying in some people. In these cases, treatment is continued for a lifetime. Also, some people experience adverse side effects to interferons and thus must be withdrawn. And in hepatitis C cases, the virus can cause liver inflammation and is among the most dangerous viruses in the hepatitis family. Although some infected individuals can recover without treatment within half a year, more than 50% of them can progress to chronic cases, which will later on lead to liver cancer and cirrhosis. Treatments for chronic conditions are aimed to cure the disease using antiviral therapy of interferon and ribavirin combined. However, adverse side effects cause most people to cancel treatment. On the other hand, the rare acute liver failure happens as quickly as 2 days, which means that most cases are initially difficult to detect. Reasons for rapid liver failure include overdosing on acetaminophen, an over-the-counter pain reliever, adverse reaction to certain herbal or prescription medicines, injection of wild mushrooms, and viruses like hepatitis C, B, and A. Intensive supportive care is important for people with acute liver failure to ensure that symptoms are treated while undergoing recovery or at least the disease's effects are minimized. For example, patients with a hepatitis A virus can have supportive care to avoid dehydration while their bodies are fighting the infection. In some cases, long-term monitoring is required. In the case of overdosing and poisoning, these can be treated and reversed when they are detected early. So, to avoid or minimize liver diseases, healthy lifestyle and regular medical checks must be practiced. Maintaining a well-balanced diet and active body help avoid non-alcoholic fatty liver disease, which can lead to complications. Alcohol intake must be limited and avoided if you already have liver disease. Regular medical checks will help you and your doctor monitor your overall well-being and detect early signs of liver cancer.